Fellas, listen up, especially my men over 60. Because there are 3 huge mistakes guys your age are making when they masturbate, and they can genuinely mess with your erections, your sensitivity, and even your confidence. And most of you have no idea you're doing them. I'm talking about things that can lead to numbness, weaker blood flow, delayed climax, or even pain. All from what should be a completely normal, healthy, enjoyable part of your life. But here's the deal. None of this means you're broken. None of this means you're too old. And you definitely don't need to give up pleasure. In fact, once you understand what's really going on and you fix these 3 mistakes, you can actually experience better sensation, stronger erections, and more confidence than you've had in years. I see it every day. All right, fellas, let me ease your mind for a second, because everything I just mentioned is fixable, and not with surgery, not with weird gadgets, and definitely not with just accepted advice. These issues usually come down to habits, technique, blood flow, and a little bit of nerve health, all things we can improve quickly. Most men over 60 think, well, this is just aging. Nope, not true. Your body is incredibly responsive, even now. I've had patients come into my office worried, embarrassed, convinced something was seriously wrong. And within 7 to 14 days, sometimes even sooner, they start seeing changes. Better sensitivity, less irritation, stronger response, more confidence when they're alone and with a partner. So if you're sitting there thinking, is it too late for me? Absolutely not. You just need the right information and a safer way to approach things. And once you make a couple small shifts, the improvements can feel almost immediate. You're in the right place. Let's get you feeling good again. So if you're new here, hi, I'm Dr. Rachel Rubin. I'm a urologist and sexual medicine specialist, and I spend my entire career helping men keep their erections strong, their hormones balanced, and their confidence high, well into their 50s, 60s, 70s, and beyond. I work with guys from every background: retired athletes, executives, teachers, grandpas, newly divorced men, happily married men, and they all come in with the same worries you probably have right now. Why does this feel different? Why isn't my body responding the way it used to? Am I doing something wrong? And let me tell you, you are not alone, and you are not crazy. There are very real, very normal changes that happen with age, and once you understand them, you can absolutely work with your body instead of fighting against it. My job is to give you straight answers, without shame, without confusion, and without the nonsense you've probably heard online. I'm here to help you protect your sexual health, improve your performance, and feel like yourself again, starting today. All right, fellas, let's talk about the real problem. The thing almost no one explains to men over 60. Because when it comes to masturbation, the issue isn't the act itself. It's what your body is doing behind the scenes that slowly changes how everything feels and responds. The hidden enemy here is a combination of inflammation, reduced blood flow, and nerve fatigue, a triple hit that sneaks up on you as you age. Most guys don't even notice it happening. It's like a slow drip, year after year. Your circulation isn't as efficient as it used to be, so the tissues in your penis don't get that strong, instant surge of blood the way they did at 20 or 30. Think of it like a garden hose. When you're younger, you turn the faucet and get full pressure. After 60, the hose still works. The pressure is just lower, the flow is slower, and it takes a little more time to build up. At the same time, the nerves in the penis, which control sensitivity, arousal, and pleasure, can become a bit overstimulated or understimulated depending on your habits. That's what I mean by nerve fatigue. It's like a car battery that's been used for years. It still runs, but it doesn't fire up instantly, and it drains a little faster. And then there's chronic, low-grade inflammation. This is the one guys really underestimate. Inflammation comes from stress, poor sleep, medications, diabetes, cholesterol issues, high blood pressure, all that life happens stuff. It stiffens the blood vessels, dulls nerve signals, and makes recovery slower. So when you masturbate in a way that's too aggressive, too tight, too dry, or too frequent without proper technique, you end up irritating tissues that are already working harder than they used to. Here's the tricky part. Most men blame themselves, or they blame aging. Guess I just can't feel it anymore. Guess this is normal. But what's actually happening is mechanical strain on a system that needs a little more care, not less pleasure. It's not your fault. It's not weakness. It's not a loss of masculinity. It's simply physiology. And when you understand these changes, the slower fuel pump, the tired battery, the stiffened hose, the overworked nerves, you can adjust your technique and instantly protect your sexual health instead of unintentionally harming it. This is why the 3 big masturbation mistakes later in this video hit harder after 60, and why fixing them helps guys feel better incredibly fast. Okay, fellas, let's go a little deeper, in a way that actually makes sense, because once you understand what's happening inside your body, every choice you make afterward becomes easier, smarter, and way more effective. Let's start with the big one, blood flow. Your penis is basically a hydraulic system. Erections happen when blood rushes into 2 long chambers, the corpora cavernosa, and gets trapped there. Simple. But after 60, those blood vessels aren't as elastic as they used to be. They're a little stiff, a little resistant. Picture a brand new rubber band versus one that's been in a junk drawer for 10 years. The older one still works, but it doesn't stretch as easily. So when you masturbate with too much pressure or too much friction, you're actually forcing those vessels to work harder than they can comfortably handle. It's like pushing water through a partially clogged pipe. That's where irritation, weaker erections, and delayed climax creep in. Now let's talk nerves. Your penis is loaded, absolutely loaded, with sensory nerves. These nerves send signals to your brain saying, "Hey, this feels good," or "Hey, let's get ready for action." But nerve endings are sensitive to 2 enemies, overstimulation and understimulation. Overstimulation happens when you're using a grip that's way too tight, or going too fast, or using a technique that your partner could never match. Understimulation happens when circulation is lower, inflammation is higher, or sensitivity has declined from years of stress on the system. Either way, your body starts compensating. And that's when you notice numbness, needing more intensity, or struggling to stay aroused. Then there's nitric oxide. This is the chemical that tells your blood vessels, relax so more blood can enter. It's the reason medications like Viagra even work. But nitric oxide levels naturally decline as you age, especially after 60. And things like poor sleep, stress, diabetes, or high blood pressure drain it even faster. So think about this. Your vessels are stiffer. Your nerves are more sensitive to strain. Your nitric oxide is lower. Your recovery time is slower. Put all that together, and what used to be a simple, reliable activity, masturbation, now requires a little more intention. And this part is important. Older tissue heals more slowly. If you irritate or inflame the penis at 25, your body shrugs it off overnight. At 60 or 70, that same irritation might linger, not permanently, not dangerously, just enough to affect your next session or your next erection. This doesn't mean masturbation is bad. It means masturbation needs to be smarter. And when you approach it with better blood flow, better nerve protection, and better technique, you stop the cycle of irritation and start the cycle of healing. That's when sensitivity improves. That's when erections get stronger. That's when climax feels easier again. And yes, you can absolutely get those results. Guys do every day. Now that you understand what's happening inside the body, you're ready for the part that really changes things, the fix. All right, fellas, here's the part most men over 60 never hear, and it's the biggest game changer. Key number 1 fix to masturbating safely and keeping your erection strong as you age is this. Switch from high-pressure, high-friction stimulation to slow, intentional, blood flow-friendly stimulation. I know that sounds almost too simple, but stay with me because the why behind this is powerful. Most guys, especially as sensation declines, start gripping tighter, going faster, or using more friction to make up for the lost feeling. It works in the moment, but long-term, it irritates the nerves, strains the blood vessels, and reduces sensitivity even more. It's a cycle. The fix breaks that cycle. Here's what the fix actually is. You want to masturbate in a way that encourages blood flow, protects your nerves, and reduces micro-tearing of the skin and tissue. That means more lubrication, less squeezing, slower buildup, more awareness, and better warm-up for the tissue. Sounds simple, but biologically, it's profound. Why it works? Because when you reduce pressure, the blood vessels stay open instead of being compressed. That means more blood can enter, which boosts sensitivity, boosts erection strength, and boosts nitric oxide levels. Your nerves stay calm and responsive instead of overstimulated and fatigued. Your tissue gets a chance to stay healthy instead of irritated. This is how men in their 60s, 70s, even 80s start saying, "Wow, this actually feels better than it has in years." When to do it: every time you masturbate, starting today. You don't need a special device or a routine. Just shift the way you approach it. How to do it. 1. Always use lubrication. Every time dry friction is the enemy of sensitivity. At your age, lubrication is non-negotiable. Your skin is thinner, circulation is slower, and moisture levels are lower. Use lube. Trust me. 2. Treat it like a warm-up. Spend 30-60 seconds just getting the blood flowing with gentle stimulation. Think of it like priming the pump. You don't jump into a workout cold, and your penis doesn't like being cold-started either. 3. Loosen the grip by at least 50%. Your goal is to reduce compression on the nerves and vessels. If you normally grip like you're holding on for dear life, lighten it up. You'll be shocked at how much better things feel after a week. 4. Slow your pace. Fast strokes create nerve fatigue. Slow, steady stimulation gives the nerves time to fire properly and gives the blood time to build. 5. Change the angle. Most men have used the exact same technique for 40+ years. Rotating slightly or shifting the angle takes pressure off the same nerves and distributes sensation more evenly. What to avoid? No dry friction, no super tight death grip, no rushing, no overstimulation when you're already feeling numb, no abrasive materials or aggressive techniques. These mistakes are literally what cause numbness, irritation, weaker erections, and difficulty finishing. What to expect when you do it right. Within 7 to 10 days, most men notice more sensitivity, less irritation, faster erections, stronger climax, better morning wood, more confidence, especially with a partner, and within 3 to 4 weeks, the changes can be dramatic. Not because you're fixing yourself, you were never broken, but because your body finally gets what it needs. Better blood flow, happier nerves, and healthier tissue. This is the foundation. And if you want to take things even further, we can stack on some powerful upgrades. All right, fellas, now that you've got the primary fix, lighter pressure, better lubrication, slower buildup, let's stack on a few powerful upgrades. These are the little habits that take you from things feel okay to holy crap, things feel amazing again. These are the exact strategies I teach men in my clinic when they want next-level sensitivity, stronger erections, and better performance, both solo and with a partner. Bonus tip number 1, the 10-minute blood flow booster. This one is huge. Before you masturbate, do 10 minutes of light movement. A short walk, marching in place, easy squats, gentle stretching. You don't need a workout. Just get the blood moving. Why? Because blood flow to the penis improves dramatically when your heart rate increases even slightly. A penis with better circulation responds faster, gets firmer, and stays more sensitive. Think of it as bringing the hose pressure up before you turn the faucet on. Men are shocked at how much this boosts performance. And it works immediately. Bonus tip number 2, the warm towel trick. This one feels luxurious and works like magic. Take a warm, not hot, washcloth and place it around your penis for about 60 seconds before you start. That's it. The warmth relaxes the smooth muscle in your blood vessels and lets more blood enter the erectile tissue. It's like preheating the oven. Everything works better. Plus, it reduces the risk of irritation and increases sensation. Older tissue responds incredibly well to heat. Bonus. Tip number 3, L-citrulline for nitric oxide support. If you want a supplement that genuinely helps without hype, this is the one. L-citrulline is an amino acid that your body converts into nitric oxide, the molecule that tells your blood vessels to relax and let more blood in. I recommend it all the time in my clinic because it's safe, well-studied, and actually effective for men over 60. Most guys notice better firmness, better endurance, better fullness, better morning erections. If you're already taking heart medications or have blood pressure questions, talk to your doctor. But for most men, this is a very helpful addition. Bonus tip number 4, the stop before you numb out rule. This rule alone can save your nerves. Here's what I tell my patients. If at any point you feel yourself getting less sensitive, not most stop. Pause. Reset. That numbness is your nerves getting overwhelmed. Just take 20-30 seconds, breathe, maybe switch to lighter stimulation or even change positions. This helps resensitize the area and prevents nerve fatigue from building up over time. Guys who follow this rule consistently report narros, better control, better sensation, easier orgasms, less frustration. Remember, you're training your nerves to respond well, not burn out. Fellas, let's bring this back to why we're talking about all of this in the first place. Because if you're over 60 and you ignore these changes, the blood flow slowdown, the nerve fatigue, the inflammation, you don't just lose a little sensitivity. You risk creating a cycle that gets harder and harder to climb out of. When you keep using the same old high-pressure, high-friction habits, your body adapts in the wrong direction. Nerves get duller, blood flow gets weaker, climax gets harder to reach, frustration builds, confidence slips, and I see this all the time. Men think something is wrong with them, when really it's just years of tiny, repetitive strain on a system that needs more support, not more punishment. But here's the encouraging part. Every one of those issues is preventable, and most of them are reversible. That's why this matters. You're not just tweaking your technique to make things feel nicer. You're protecting your long-term sexual function. You're giving your blood vessels a chance to stay healthy. You're keeping your nerves sharp. You're reducing irritation instead of piling more on. These little daily choices, the lighter grip, the warm-up, the better blood flow, the pause when things get numb, they're not small. They add up. They change the entire trajectory of how your body responds over the next 5, 10, 15 years. So don't brush this off as just masturbation advice. This is how you safeguard one of the most important parts of your health, your identity, your confidence, and your relationships. And the best part, you can start today, and you can start feeling a difference this week. Now, let me paint a picture for you, because this is the part I love most. When guys finally realize what's actually possible for the Imagine, waking up in the morning and noticing you're getting those firmer, fuller erections again, the kind you thought were behind you. Not because you took a pill, not because you forced anything, but because your circulation and nerves are finally working with you, not against you. Imagine touching yourself and feeling more sensation than you've had in years. Not that dull, numb feeling, not that "why isn't this doing anything" moment, but real, satisfying responsiveness. That spark that tells you, yep, my body still works. I'm still in this game. Imagine climax, feeling easier, stronger, and more predictable. No more wondering if it's going to happen. No more marathon sessions that leave you frustrated or wiped out. And imagine what that does to your mindset, your mood, your swagger. Because confidence is contagious. When you feel better in your body, you show up differently. You carry yourself differently. You're more playful, more connected, more open, more present, whether you're single or partnered. I see men go from anxious and defeated to energized and vibrant in just a few weeks. When you take care of your sexual health, your whole life elevates. Your sleep improves. Your stress drops. You feel more like yourself again, not the older, frustrated version you thought you had to settle for, but the version of you that's sharp, alive, confident, and capable. And this isn't fantasy. This isn't wishful thinking. This is what happens when you treat your body with the respect and understanding it deserves at this age. You don't need to be 25 to feel good. You just need a smarter approach, and that's exactly what you're building right now. All right, fellas, if you made it this far, I'm proud of you. Most men never talk about this stuff, let alone take the time to understand their bodies and make real changes. So genuinely, good for you. If something in this video clicked for you, or if you've noticed any of the issues we talked about, I'd love to hear your experience in the comments. You'd be surprised how many men your age are going through the same thing, and your story might help someone else feel less alone. And if you've tried any of these tips, the lighter grip, the warm towel, the slow build-up, let me know how it's going. I read your comments, and they help me know what else you want more guidance on. If you want to keep learning, I've got plenty of other videos where we dive into erections, hormones, nerve health, and everything you need to stay confident and vibrant as you get older. So check those out next. They're all designed to make this part of your life easier, healthier, and more enjoyable. And of course, if you want more videos like this, just stick around. I've got a lot more coming your way, and I'm here to help you stay strong, stay informed, and stay in control of your sexual health. Take care of yourselves, fellas. You deserve to feel good.